The crew's all here. Here we are with, Beth calls her America's sweetheart because the
Beth
favorite. And then we have Megan, our new all-star, rock star injector. So what we're gonna do today is Lizzie's talks. We're gonna do some global talks as well as the neck. And I say this often, it's easier to prevent a neck than it is to chase a neck. Am I right, Meg?
You're right.
And it becomes an area of really big distraction for patients as we get older. So I'm going to demonstrate how you can assess a neck and decide whether Botox would be a good option for you. So go ahead and Lizzie and say E. Good. So when she says E, you can see these bands. What these bands are platysmal bands. They're muscles of the neck, and what they do is they come up the neck and they wrap around the mandible. And when they wrap around the mandible, they pull it down. And so what we do is we relax the bands of the neck. There are 8 total. We're going to relax 2 in the front and then 2 on the lateral aspect. In a couple of days, when Lizzie goes E, she won't be able to do that. The secondary piece that happens, other than the bands disappearing and giving a subtle lift, is that it also refines the jawline. So it will create more of a snatched jawline. We are going to do a cotophono lift on her too, which is a new study that everybody should go out and read. It shows how by releasing the muscles on the superior aspect of the jawline, how it actually gives a whole lift of the cheek and it supports the under eye. So again, it's all about the details. And this is a patient, this is not really a patient, this is our love, who appreciates details. So anytime you're going to do neck, it's best on people who really appreciate the details, but it's always easier to prevent one than to chase one. Okay, you do your magic.
Okay.
I'm excited. Are you excited?
I'm very excited. Okay, I'm going to have you E for me.
Now, what I love about the way that Megan injects is that she is extremely slow and thoughtful. Her precision is what really drew me to her. The fact that she is so intentional with all of her placement. She has an ICU background, so she has that medical aspect as well. But when it comes to injections in the aesthetic space, she will stare and she will not inject until she has created her whole plan. And so she's been great for us in this practice because she's really taught me to pause a little bit and slow down and really do a full assessment to just a beautiful, precise ability. Beautiful. So there are names to the platysmal bands. The ones that Megan is injecting, these are the frontal platysmal bands. These are the mid-frontal platysmal bands, the lateral platysmal bands, and the most lateral platysmal bands. And it is important to document all of them. In terms of pain level for the platysmals, it's really not painful at all. I think the crows are a little bit more sensitive, the chin is more sensitive, the neck really isn't hard at all. Yeah, and you can be kind of superficial. Yeah, perfect. Beautiful.
Alright, and then we'll take a peek in 2 weeks and see how it looks, and if we need to touch it up, we will.
Thank you.
All right.